This is a story about a man we only know as Mr. P, and what his experience tells us about the changing role of men in families, and about the strange, sometimes painful, and kind of amazing way that we relate to other people. Mr. P's story starts in 2019, when he and his wife were expecting their first kid in about 2 months. Mrs. P went in for a routine prenatal visit, and there she discovered that her blood pressure was super high, 190 over 110. She had preeclampsia, and her life and the life of her baby were at risk. The treatment for preeclampsia is giving birth, but it was a delicate balance between Mrs. P's health and the risks of delivering a premature baby. Eventually, a healthy but premature baby girl was delivered by C-section and whisked away to the NICU, and that's about the time that Mr. P started crying out in pain. The doctors were pressing on Mrs. P's belly, standard practice to press firmly on a woman's uterus in order to help prevent hemorrhages after birth. But it hurts. And every time that the doctors would press down on his wife's abdomen, Mr. P would yelp. Mr. P was experiencing something called sympathetic pregnancy, or what scientists call Couvade syndrome, when men experience some of the same symptoms that their pregnant partners do. Things like nausea and vomiting, pain, emotional changes, weight gain, things like that. Sympathetic pregnancy is often the butt of jokes, and can definitely be ripe content for unoriginal stock photography. But it's a very real thing. And today we're going to talk about what sympathetic pregnancy looks like, what causes it, and how to treat it. Thanks for joining me. My name is Eric, and I'm a dad and a former scientist. And on this channel, I break down the science behind fatherhood, and parenthood more broadly. If you enjoy this video, please give it a like and consider subscribing. And if you have a question about becoming a parent or being one that you want me to research, please share it in the comments and I'll dig into it. Back to Mr. P. We're lucky to learn about his experience because of a case study his doctors published in 2021. But Couvade syndrome isn't actually studied very much. The term Couvade was coined in the 19th century by the British ethnographer Edward Burnett Tyler to describe birth rituals in non-Western cultures. Eventually, 20th century scientists borrowed the term to describe a collection of symptoms they started to notice in men whose wives were pregnant, especially in the Western industrialized societies that they were focused on. They called the phenomenon Couvade syndrome. Early accounts in the medical literature heavily pathologized the men experiencing these symptoms, which included things like nausea, aches and pain, bloating. One study in 1955, recounted here in Time magazine, linked the syndrome to schizophrenia and psychosis, a psychoanalytic rejection of the baby, or, of course, men who were simply being too sensitive. But other scientists started to recognize that the experience was actually pretty common and not usually associated with psychiatric disorders. One of the first controlled studies of Couvade syndrome came in 1965 by this guy, Sir William Henry Trethewey, and his co-author M.F. Conlin. They were a couple psychiatrists working in Birmingham, England, and they gave a questionnaire to a few hundred men whose wives had just delivered babies at a hospital there. The survey asked if, over the past 9 months, they'd felt any of a range of symptoms, including nausea or vomiting, appetite changes, toothaches, or other pain, that kind of thing. The new fathers were also asked about their anxiety related to the pregnancy. Trethewey and Conlin then gave a similar questionnaire to a couple hundred married men whose wives had not recently given birth. The new fathers were much more likely to experience multiple symptoms, and their symptoms were largely restricted to the period of pregnancy, rather than chronic and therefore unrelated. Specifically, new fathers reported much more frequent nausea and vomiting, toothache, and loss of appetite. And these symptoms were also much more common in men who said that they were anxious about their wife's pregnancies. That's a common theme. Anxiety seems to explain a lot about the experience of sympathetic pregnancy, but it can certainly extend well beyond just a nervous stomach, like with Mr. P, who cried out in pain when his wife was hurting. Another expectant father had a similar experience, saying that he had stomach pains that felt like his wife's contractions, at least as far as he could tell. And to be clear, although anxiety seems central to sympathetic pregnancy, it's not all in our heads. Men's hormones do change throughout pregnancy and after birth, and there's evidence that these hormonal changes are related to sympathetic pregnancy. One study found that men who had more Couvade symptoms had higher levels of prolactin, a hormone associated with parental care, and the same hormone that stimulates milk production in women. These men also had larger decreases in their testosterone levels in response to the smell, sound, and sight of babies. But it's kind of impossible to tell whether these hormonal changes are causing Couvade syndrome or the other way around. And sympathetic pregnancy seems to be experienced most strongly by men who are more involved with and attuned to their partner's pregnancy. The symptoms tend to peak in the first and third trimesters, precisely when most women's pregnancy symptoms are the worst. And Couvade syndrome is incredibly common. One review of other studies cited an overall estimate of occurrence of between 11 and 97%, which is not really a helpful range. But most studies put it at somewhere between a quarter and half of men experiencing something akin to sympathetic pregnancy. And the experience is global, documented in men across many countries. The problem is, there's never been an agreed upon definition of what Couvade syndrome really is, or what collection of symptoms, or their severity or duration would qualify a man for this diagnosis. It doesn't have an official diagnosis at all, which makes it almost impossible to study accurately. No study that I could find has actually tried to treat sympathetic pregnancy. Most research on the condition shows that the symptoms tend to decrease after birth, if not earlier. Sometimes the moment of relief is abrupt. The same man who earlier said that his stomach pains felt like contractions described how they disappeared right at the moment of birth, quote, like someone turning the light off. That Couvade symptoms often drop off after birth probably reflects a sudden drop in anxiety when it becomes clear that mom and baby are okay. But new fathers, like new mothers, can experience postpartum anxiety and depression as well. And indeed, sometimes sympathetic pregnancy symptoms linger for months. In more extreme cases, the symptoms may last even longer, especially if the affected man is away from home. Take this case report of an Australian soldier who was separated from his pregnant wife. He had a greatly distended stomach, which disappeared when he was under anesthesia. His ailment lasted nearly 2 years until he could get home and see his new child and wife. Before birth, anything that helps relieve the anxious feelings that seem to underlie most of the symptoms could help, from talking about it to meditation or exercise. Another treatment might be simply acknowledging the experience. Sometimes when we name and acknowledge our bad feelings, they're easier to handle. But it will take more research to know for sure what steps might help men find relief before their baby is born. So how did Mr. P fare? He seemed largely unbothered by his symptoms, which included morning sickness and vomiting, food cravings, weight gain, and a drop in his libido. He felt it reflected a, quote, special connection with his wife. When his wife was diagnosed with preeclampsia, his anxiety and his Couvade symptoms spiked. During Mrs. P's labor, he was even awoken by bouts of intense abdominal pain, despite the fact that he was at home at the time, away from the hospital. Still, he intuited the cause, his anxiety about the health of his wife and baby, and even seemed to welcome the opportunity to feel closer to his wife. Fortunately, their baby girl did well and was soon released from the hospital. By all accounts, Mr. P's symptoms faded as his family's health became more secure. Wherever you are, Mr. and Mrs. P, and now little baby girl P as well, I wish you the best. If you enjoyed this video, please like it and subscribe to the channel. I plan to dive into the science of fatherhood and share tips on managing this big life project. Have a question about pregnancy, birth, or child development you want to know the answer to? Leave it in the comments, and I'll do my best to dig into it. Until next time, thanks for watching.